The delusion of feeling dead. More than 100 years ago, a French physician named Jules Cotard encountered a patient who affirms not to have many organs but only a body in decomposition. This rare clinical event is now known as Cotard Syndrome, in which the individual judges himself or everybody in the world as dead or reduced to nothing, being able to judge himself as a zombie. Since initially described, further cases have been reported. However, it remains a rare entity. It is good to know that this syndrome is not counted as a separate disease, and it's rather a symptom of another underlying condition, such as depression, schizophrenia, bipolar disorder, and even dementia, brain tumors, stroke, and traumatic brain injury. It has also been reported as a rare side effect of some medications. This syndrome can also have other variable presentations, such as a person feeling immortal, not having any organs, or denying pregnancy despite obvious evidence. Nowadays, the syndrome is classified under the umbrella of delusional misidentification syndromes and has 3 subtypes. The first is called psychotic depression, which includes patients with melancholia and a few nihilistic delusions. The second type, called Cotard Syndrome Type 2, includes conditions that course with nihilistic delusions in the absence of mood changes. And the third, Cotard Syndrome Type 2, includes conditions which course with anxiety, depression, immortality delusion, nihilistic delusion, and auditory hallucinations. Exact mechanism behind this syndrome is not clear. However, some studies have suggested impairment of areas of the brain that are involved with familiarity and belief evaluation, such as the right cerebral hemisphere. Cotard syndrome is a rare condition. Therefore, it is not clear which treatment should be considered as the first choice. Electroconvulsive therapy has been the preferred treatment for Cotard syndrome in several case reports. Regardless, Cotard syndrome involves a big suicide risk, and because of that, it is recommended to institute treatment as early as possible and get patients admitted to a psychiatric unit. After all, anything can come from a person feeling dead, as they don't have anything to lose.